All right, well, good afternoon, and thank you for joining today's briefing with the Department of Finance. I'm Bismarck Obando. I'm the Cal City's Director of Public Affairs, and I'm going to be moderating this session. As part of today's session, the Department of Finance will provide an update on CARES Act city monitoring responsibilities. We'll discuss some best practices and provide updates on the state program oversight, monitoring, and interaction with recent federal guidelines. Additionally, ahead of the week of March 15th opening of the web portal for Cycle 4 reporting, they're going to be providing a walkthrough of the state Cycle 4 reporting requirements. Before we get started, I want to take care of a few housekeeping items. Please make sure your audio is connected. You have been prompted to connect your audio when joining the webinar, but you can confirm by clicking the audio settings on your toolbar. As you may have noticed, we have muted all the phone lines for all participants, but we will have the opportunity for live questions throughout the presentation. And I also want you to know that the meeting is being recorded. To ask a verbal question or make a comment, use the raise hand feature by clicking on the participant button on your toolbar, or you can type in your question into the Q&A box. If you see your hand raised, I will make sure that Melissa opens up your line so that you can ask a verbal question. Otherwise, if you put in your question in the Q&A box, we'll read it off and we'll hopefully have a response for you either on the chat box or verbally from one of our presenters. So why don't we get started? We have about until 3:30 today to get this briefing and answer your questions. But with us, we have Kristin Shelton, who's the Chief of Research and Analysis for the Department of Finance. We have Audrey Bezos, who's a Principal Program Budget Analyst in the Research and Analysis Unit for Department of Finance, and JC Thompson, who's the Principal Program Budget Analyst in the Research and Analysis Unit for the Department of Finance. So with that, I'm going to turn it over to Kristin for her briefing. Kristin?
Thank you so much, and I appreciate everybody taking time. What Bismarck did not say is that Audrey and JC are my right and left arm and have been my partners throughout this process as we're doing all of our work related to COVID. Certainly, we did not anticipate that the American Rescue Plan would be passed by the House today. So things have been a little bit exciting in our world. If there is time at the end, I can provide a few highlights relative to that. Again, it's going to depend on time at the end. So Audrey is sharing our presentation, and similar to all of the presentations that we've done in partnership with the League, they're recording and then it will be posted and shared with attendees.
Sorry, Kristin, I'm just, the bar at the top is preventing me from getting to the right view. So I'm just trying to move this out of the way so that I can get to the right view.
I think if you can see, there's a little tiny icon, I think up near the top left corner. If you click on that, so it's to the right of the little save.
Okay. Maybe. Right yeah, there we go. Thank you.
Yes. Okay, so with that, we will get started. So Audrey and JC will do their best to answer questions as they come up in the chat. And then, as mentioned, if somebody wants to ask a verbal question, certainly feel free. My team will interrupt me. They're well versed at kind of keeping me on track and flagging things for me that I need to pay attention to as we're working through the presentation. So today we want to cover a number of things. So first, the reporting requirements related to the state-directed coronavirus relief funds. We want to talk a little bit about the Coronavirus Relief Fund expenditure deadline, both in state law and in federal law. We want to talk a little bit as well about recent changes in FEMA and some considerations relative to the FEMA reimbursements. And then we're going to go through in a little more detail and give you an opportunity to ask questions about the monitoring process and the letter that was distributed along with the meeting invitation that came from finance through the email. So first, related to the coronavirus relief funds, who needs to report? our entities fall into a few groups. So any entity that hasn't fully spent their coronavirus relief funds, for obvious reasons, needs to report. An entity that has reported in a prior cycle any remaining obligations. Those remaining obligations, when we roll over between cycles, if you'll recall, those go away. And generally, we expect you to report those as expenditures that have now been liquidated from the prior cycle, compared to the prior cycle. Any entity that has only reported full expenditures in one cycle, we'll talk a lot more about that in future slides. And then any entity that needs to or wants to reallocate expenditures, such as moving between categories. We know that there's been some interest. We saw some amount of this happening in our cycle 3 report, where you're maybe moving things out of that public health, public safety category, for instance, into another category based on more actual data that you have based on that cycle of reporting. If you do move money between categories, that's considered a material change, and that's going to require you to have to report for one more cycle. That'll be a little more clear when we get to the next slide, which really talks about the requirement that for entities that have already fulfilled their reporting requirements. So basically, the way we've defined it and how we've kind of approached each of our cycles is only entities that have reported full expenditures, so no remaining obligations, and the full allocation has been spent in 2 consecutive reporting cycles. So another way to look at that is that we really want those 2 cycles to be consecutive. So that means you would meet this test if you had reported full expenditure in both cycle 1 and cycle 2, or full expenditures in cycle 2 and cycle 3, and you've made no changes to your report, or no changes are needed. So all of the data that was reported, even if some estimates were made in the process, so no changes are needed and no movement between categories of expenditure. I want to talk a little bit about the timeline that we're working under. So we are still expecting all of the reports to come in based on cost incurred by December 30th of 2020. So while the recent federal legislation extended the federal deadline to December 31st, 2021, state law has not changed. That was outlined in our 2020 Budget Act, and state law still says that the coronavirus relief funds must be spent by December 30th, 2020. Just real quick, related to kind of the distinction between what we consider expended and often, and I think we've talked about this before, often how we define an expenditure from a governmental accounting perspective is slightly different than the way in which the Treasury OIG has defined it. So based on the federal definition, funds are viewed as expended when a service has been rendered or a good has been delivered. So everything basically anchors to that time frame and should have been either delivered or completed by December 30th, 2020. Excuse me. It does not mean that the check or the payment for that good or service has to have been cut yet. Excuse me, hold on. Okay, so essentially in that framework, there is allowance for a reasonable liquidation period, which the Treasury has broadly defined as 90 days. Although there's no specific requirement around that. That's just a general expectation that's been set. What that means is when you log into the Coronavirus Relief Fund reporting portal, all of the expenditures that are reported for this cycle are going to go into the category that's titled the expenditure adjustments prior cycles. So only in that column. You'll see that the next to that column, it specifies cycle 4 covers that period from January 1st, 2021 through March 31st, 2021. Because state law is still operating under expenditures incurred by 12/30/2020, nothing should be reported in those columns. So all of the funds would be reported as spent, fully spent, hopefully for this cycle. And any unspent funds under the current state framework, statutory framework, would have to be returned to the state. I do want to reassure you that at this time, we don't expect people to write us a check. If any entities still have unspent funds after we complete this reporting cycle, we will contact you to talk about what the next steps are and what they would look like. But broadly, the current framework says those funds need to be returned to the state. There's a couple differences from prior reports, and it kind of really centers around the idea of the date and the deadlines that are in statute. So that means that this cycle 4 report should not include any remaining obligations. We would expect in almost every instance that remaining obligations would be liquidated as of this reporting cycle. And we can talk with entities that maybe haven't received a particular good or service as yet. They've had, through good faith efforts, they've had their contracts or purchase orders were completed, and there was a supply chain or interruption delay, which we've talked about in prior presentations, that there might be kind of these outlier kind of examples that we can handle separately. But generally, we would not be included, or we would not be expecting to see remaining obligations. If they're there, we're probably going to reach out to you if we haven't already spoken to you. Also, we would expect all of the expenditures to be reflected, as I discussed previously, in that expenditure adjustments. No expenditures should be reported in that current cycle column, as it's not permitted under state law. A couple very general and high-level reminders related to kind of the portal and the use of the portal, which we're not demoing today. We think it's fairly straightforward and everybody's pretty familiar with it at this point, is to not use a browser other than Google Chrome, if possible. We have tested our environment in both Google Chrome and Edge, and both generally work. Google Chrome works best. Internet Explorer does not work, so please don't use it. You will get partway into the system, and the forms that really is where you report all of the expenditures will not display properly. Just as another reminder, each record is associated with the user that created the report, unless we've changed it for you due to staffing changes. So if for any reason during our reporting window, which is going to broadly go from March 15th through April 6th, if somebody is either out of the office on any kind of extended leave, or the person that filed the last report is no longer with your city, you'll need to contact us so that we can get the record and the account switched over to a new email address, because that is how we associate the record with a particular entity. No entities are able to create new reports. That's something that we blocked in a prior cycle adjustment. And the allocation amount, so the amount that's been awarded, cannot be changed. Those are locked in our system and tie to what was allocated and dispersed by the controller. And then the final item that has been changed or locked is the DUNS number. So while we early on encouraged everybody to have a DUNS number, the DUNS number had to be both valid and active within the sam.gov portal. And all of the records and the data that we report is associated with either the number that was provided that was valid and active at the time of our first federal report, or we came up with another unique number to identify your record. And so those have to stay throughout all of the cumulative reporting that we do with the federal government. And as another reminder, it's important to save a copy of your report before you exit or log off the system. So we recommend that people check the checkbox to certify and submit the data. You can only check that as long as your expenditures do not exceed your total allocation amount. And you would basically use the, on the review and finalize screen, the print feature, and you would print to a PDF that allows you to then save down a copy of your report in a PDF format. Reports cannot be accessed when the system is locked. So this was a very rapid development process, limited functionality. We are not saving in our system any records or cumulative reports from each cycle. We basically roll the data over for the next cycle. So at any given time, we can only view and provide copies of the reports for the current cycle or the last cycle. Quickly touching on our reporting due dates. So as I mentioned earlier, all reports are due no later than April 6th of 2021. And we would expect just a small handful of entities to kind of be following that timeline based on where we are in our broader reporting trajectory. So at this point in time, only 8 counties and 34 cities have not fully spent their funding. That means that we'd like to be focusing our energy on finalizing and closing out those last few cities and counties that haven't fully spent their funds. As of our cycle 2, we had 7 counties that had fully spent 264 cities. And then in cycle 3, this number increased tremendously, and we had an additional 43 counties and 176 cities that have fully spent. For all of those entities that have had both fully spent and are going to be this cycle, their second consecutive cycle, we would ask that those entities, if they have no changes, to report no later than March 30th, 2021. Essentially, we want to kind of have that process in our rearview mirror so we can focus on working with those remaining counties and cities that had not yet fully spent their funds as of our last report. This process for those entities, as long as there's no changes, is very quick. We essentially ask you to log in, review your cumulative expenditures as they've been rolled over from the prior cycles, certify and submit your report, and just before you exit, print a copy for your records. That pretty much covers the components of our CRF reporting. Are there any questions that have come in around that topic before we talk a little bit more about the interaction with FEMA reimbursements?
So I just have a few questions that I haven't answered yet. One is a question that says, what if we have supply chain issues and we're unable to receive the goods prior to 12/30? Is this expenditure still allowable?
So yes, that expenditure is still allowable because the good or service was essentially through all intentions and purposes was intended to be received by December 30th, presuming the purchase wasn't made on December 30th. And so if because of a supply chain issue, it hasn't been received, you can still report those funds. We would want to talk with you and work with you to see where you were at as of right now, if they've come in since then, right? So hopefully we aren't continuing to experience the significant disruptions that we were experiencing previously.
Right. Most of the other questions here are pretty specific to a particular entity, so I'll try to address those through the Q&A. Although someone is asking about the allocation process and how it relates to small cities and tourist-based economies being more adversely affected. And if we can speak to any attempts to address those two factors and whether any of the original CARES Act money will be made available to those entities if others don't have enough eligible costs.
So just kind of briefly referring back to the cities and counties that I mentioned at the beginning, we are down to a very small handful of cities and counties that have any funds remaining. The vast majority of those dollars, and we're really talking about in a couple hundreds of thousands, not millions even, dollars that we fully expect to be spent and reported as such during this reporting cycle. So there's no funds to be reallocated. On a brighter note, the American Rescue Plan has now passed both the Senate and the House. That particular plan does include additional funding to both state and local governments, and I can talk about that at the end if time permits, in terms of the level of funding that would be going out under that plan. So that would be the only thing that's really on the horizon that would provide additional relief to cities or counties at this point.
And just Kristin, now that you have to shoulder that, all that on your own, I appreciate all the work. Nick Roma from the League of Cities. And we're continuing to, once we get the federal relief secured, turn some attention to the state and have a discussion with the administration and the legislature about the gaps that may still exist after the federal relief, and continue to work on that. So the work is not fully complete. I appreciate the question.
Another question: for funds that were used for economic support grants or loans to small businesses, what backup or follow-up documentation is required to ensure funds were applied to qualifying expenses of the recipients?
So I'd like to talk about that in just a few slides when we talk about the monitoring. And we do have a few FAQs on our DOF website for COVID-19 and specifically the CRF reporting portal that talks a little bit about some of those parameters and the kind of information that would be recommended. There are no specific documentation requirements outlined in federal guidance. The predominant guiding factor has really been being able to demonstrate that the funds were necessary to respond to COVID, and each entity, local entity, has some discretion on how they demonstrated that or determined that it was necessary to respond to COVID, including need of a particular beneficiary related to economic support that might be offered at the local level. So hopefully that answers the question. Are we good on the questions at this point?
Yes.
Okay. So let's talk a little bit about the FEMA reimbursement process. So FEMA is obviously an additional funding source that can be used to help offset some of the expenses related to the COVID public health emergency. I think our slide must have switched. Okay, so as many are aware, earlier this year, the president signed a memorandum that essentially provided or raised the intent to provide 100% cost match for certain eligible funds under the FEMA Public Assistance Program. what that means is those certain activities or certain costs could be eligible for 100% federal funding once a determination is made that it is in fact eligible, and that eligibility could be retroactive all the way back to January of 2020, when some of the very initial work was happening around the pandemic and some costs were beginning to be incurred. That memo also expanded the eligible activities related to the types of things that could be covered. So kind of veering away a little bit of the typical disaster cost, which tend to be around, medical support and what we've been experiencing in COVID process, right? Support for testing, some support for non-congregate shelters, and it expanded it to potentially allow for costs to safely reopen and operate schools, for childcare facilities, for healthcare facilities, transit systems, and other things. At this point in time, there is no guidance available on those new items, and we're not exactly clear on how that may or may not interact with other funding streams that are available. The one thing that also happened and really was kind of creating pressure broadly within the disaster relief funds for major disasters is that the FEMA fund balance for the disaster relief fund is actually projected to be negative, probably negative as we speak, because it was falling into the negative zone based on the forecast in March of this year. So absent additional federal funds, which are included in the American Rescue Plan, which provides about $50 billion of additional disaster relief funds. One thing to note about these funds is those funds are not just strictly limited to COVID. It's a replenishment of that disaster relief fund, and that disaster relief fund is intended to cover all disasters. So not just the COVID pandemic, but things like dealing with freezing temperatures across the country that we heard about in recent weeks, tornadoes, fires that are often happening in California. And then the other piece about the federal relief funds is that states, counties, cities, not just across the country, but within California, are all competing for and trying to access these funds. Often we think about funding that may come, federal funding that may come to California representing about 10% of the total dollars available. If that is the case here relative to this replenishment of the disaster relief fund, which is $50 billion, at most, we could be looking at about $5 billion for California in terms of being able to access these funds. So while, additional funding and replenishment is a really positive thing, it's still going to be a fund source that likely has many calls on it beyond what is going to be available nationally. So just want to kind of highlight that. We all know that FEMA generally is considered a funding source of last resort. Within this pandemic, we've had FEMA as an eligible fund source. There have also been some state funding allocations that were included in the 2020 budget, as well as a number of federal allocations that can also be brought to bear to kind of address some of the cost and the impacts from the emergency. We also would acknowledge that the FEMA reimbursement process, one, requires a pretty high level of documentation and really good tracking and record keeping to be able to support those claims and be able to draw down funds and demonstrate to FEMA that the costs were necessary, that they fit within their broad categories. And then the other item is to recognize that reimbursement process takes time. So, we are continuing to work kind of at a coordinated level among the state and with our partners at Cal OES to support that reimbursement process. They have a bunch of additional information as well as staff assigned to help in different areas of the state to help help with that reimbursement process. We also encourage people to not wait. So unlike other disasters that have a real clear beginning and end date, this pandemic does not have a clear end date. And so we would not recommend that people wait until the very end of this disaster. So at least quarterly, you should be looking at your portfolio of costs, and to the extent that they fit within the FEMA parameters, should be, taking steps to pursue and prepare those FEMA claims. Right now, we understand that the prioritization within FEMA on claims is for vaccination, which makes a lot of sense to all of us that are excited about the idea of getting more people vaccinating and continuing to slow the spread of COVID. And then 2, the personal protective equipment, which is really an essential component of both safeguarding against the spread of COVID and to reopening, whether it be schools, businesses, or whatnot. So those are the 2 areas that if you were trying to think about what you would put forward to FEMA and you have to kind of manage your limited resources, those are 2 areas that are kind of high priorities right now. The other area is the funding related to the Great Plates program. We do recognize and acknowledge that to the extent Coronavirus Relief Fund was being used as a FEMA match, so was originally going to provide the 25% share of costs that would have been required under the Stafford Act, that it may cause you to need to make revisions to the expenditures that have been reported to the state related to the coronavirus relief funds. And should that happen, that would reopen your reporting requirements. Talking a little bit more about FEMA documentation and eligibility. These are just a few categories relative to claims that might be pursued or submitted. So medical care and testing kind of fall in the same bucket. So from a documentation standard, there's a general expectation that these costs are for somebody that was determined to be COVID positive or was suspected COVID positive. That includes triaging individuals that may have had COVID-related symptoms at the time they came to, let's say, a community clinic or a hospital. And then you also have to provide documentation that you took steps to pursue insurance or gather data, so that to the extent that somebody has medical insurance that would have covered the hospitalization, treatment, testing, any of those items, that we've pursued that to the greatest extent possible because FEMA is that provider of last resort. The other item, probably not as relevant to cities, but kind of is a good example of some of the equipment and some of the standards that are needed, which is if equipment was purchased in order to intended to care for COVID patients, such as ventilators, there has to be demonstration that it was actually put into service. So you can't just purchase that piece of equipment. You have to be able to demonstrate to FEMA that it was used or put into service. For personal protective equipment, one of the documentation standards relates to where that PPE went. So where was that PPE used? Early on in the pandemic, there was less kind of tracking responsibilities, but FEMA in September, or just before September, with an effective date of September 15th of 2020, essentially applied a standard to PPE that not only required understanding where it went, but that it was really only going to be funded by FEMA to the extent that it was used by what would be considered a direct responder. So police, fire, EMTs are good examples. Some areas where FEMA was kind of pulling back at that time could have included use in just what we would consider continuity of government. So just running your normal local programs and or distributing masks and things like that to schools, childcare centers, or people even in your community. We do acknowledge that the presidential memo that I mentioned a minute ago did talk about being able to have 100% FEMA reimbursement. So we don't, for schools and other things. So we don't know whether that will interact with or kind of override the September 15th, 2020 directive. What we do know is the state has purchased a number of items, PPE items, that we are receiving questions and queries from FEMA based on the project worksheet that has been submitted to them relative to one of our bigger PPE contracts. And they are actually trying to go retroactive all the way back to the beginning of the pandemic and apply that standard. So there's still a bit of ambiguity in this area, but documentation and tracking both where it went and who used it or who it went to is going to be important for FEMA reimbursement. Great Plates. So it has been approved basically on a 30-day cycle throughout the pandemic since early on in its implementation for Great Plates to be reimbursed, which will now be at 100% FEMA reimbursement. So no longer using that combination of FEMA funds and then split of the state and local non-Stafford Act share is only for those people that are very clearly documented, demonstrated as being COVID positive or exposed to COVID positive, so needing to isolate or quarantine. And then those individuals that are defined as high risk by FEMA in terms of having a very adverse outcome if they contracted COVID. One other requirement around that is that those individuals need to not be receiving assistance through another program or another means, so such as CalFresh or the Meals on Wheels program. And then the tracking also requires tracking of the duration of meal service. So how many weeks maybe did you cover it for that particular individual? Right now, the program is extended through April 8th of 2021. So we just received our last kind of re-up of the 30-day approval. At some point, we would expect that this would taper off a little bit. And finally, non-congregate shelter. So think Project Room Key generally, although it's not specifically limited to the homeless. In general, you would be using non-congregate shelter for somebody, again, COVID positive, COVID exposed, or high risk. So 65 or older in this case, and or with an underlying health condition, kind of that general list of comorbidities that seem to be put people at higher risk of COVID, adverse outcome from COVID. And then the other piece that's tucked in here is that it's not state funded. So the state has funded about $150 million worth of cost associated with Project Room Key. That included some trailers and other hotel motel expenses. In general, those costs that the state is covering would not be eligible for FEMA reimbursement because it's funded from another source. In general, we think that these dollars kind of coupled with other FEMA reimbursable activities would cover those things that might fall outside of the FEMA eligibility criteria. So maybe they were quarantined for longer. It could be that the local decision was high risk cut off at age 60, which would not meet the FEMA guidance. And so you would cover those costs with state funds. So it's kind of a braiding together of those myriad of funding sources. So we know that some folks may have some changes to the CRF reporting, as I mentioned previously, as a result of the FEMA changes. So a couple reminders relative to CRF reporting. All of the reporting is cumulative. That means that you can make changes to prior dollars that were previously reported to account for any additional FEMA reimbursements. So what that means is once there's a little bit more certainty and clarity around whether FEMA will fund something or not, whether the documentation met the FEMA standard, a future report can be amended to kind of reflect that. So you would reduce the coronavirus relief funds and essentially use those dollars in another category, provided that you had expenditures that were broadly eligible within the state law window, unless that's changed. So that March 1st to December 30th, 2020 timeframe. And just as a reminder that, everybody has kind of been advised throughout this process that public health and public safety expenses are viewed as substantially dedicated. So that can be your backstop or kind of your plan B if you're able to free up some dollars because you're able to secure additional FEMA reimbursement where there was maybe uncertainty in the past. As I've noted before, this would still be considered a material change by moving it between the categories. So then there would be at least one more report after the cycle that those kind of movements are occurring in. And so in terms of completing the reporting requirements, so after CRF has been fully spent, entities have to complete one full cycle with no changes. Two full cycles with no changes. So if you've reported fully spent in a previous cycle, your next cycle of reporting needs to stay kind of in that space. And then you would be considered completed with your reporting responsibility. If a change is made, in a future cycle, possibly to account for FEMA or for a disallowed cost or an ineligible cost, then that would kind of reopen it and you would need to follow through with a subsequent report. So by way of example, so hypothetical city, as of cycle 2, had reported to the state their allocation was fully spent. In cycle 3, they made no changes to that report. However, as part of cycle 4 reporting, there was a need to move expenditures between categories, maybe based on the FEMA discussion that I talked through a moment ago, and or because an estimate that was included in a prior cycle, once you got all of your accounting records, showed that the dollar amounts were slightly different. That means that that change would happen in cycle 4, even if it's a net zero change, but that would require then that entity to report in cycle 5. If by cycle 6, there were no further changes, then the reporting would be completed once again. I'm going to pause here before I start talking a little bit about the monitoring and audit and oversight requirements associated with these funds. Are there any questions that relate to kind of either the reporting responsibilities and or the interaction with FEMA funds?
Yes, we have a few questions. Our city did not apply for FEMA reimbursement at the beginning. We still have COVID-related expenses beyond CRF. Can we still apply for FEMA reimbursements?
Yes, so you can apply for FEMA reimbursements. You want to basically get those initial claims in. And I think there's a window. I don't recall exactly how long it is, but it's very shortly after that disaster closes, you would need to initiate kind of a claim to be able to pursue those reimbursements later. So that window has not closed because so far the disaster continues to be extended, but it is still a possibility or an option.
Okay, next question. FEMA stipulates that many items cannot be duplicatively eligible to be covered by CARES. The challenge we encounter is that there is a significant overlap between CARES and FEMA coverage for items. Even if items were eligible in FEMA category B, it seems arbitrary as to what is ultimately approved for DR 4482 coverage. Can finance comment on this?
We certainly are trying kind of in our role, because we have insight onto both sides. The state has been planning to use the portion of state coronavirus relief funds that we retained to help provide that FEMA match. So we are currently also trying to assess that and navigate sometimes what could on the surface appear arbitrary in terms of FEMA eligibility. So we gave you just a very few examples around what could be FEMA eligible. We certainly encourage you to reach out to and work with the Cal OES partners, as they have a lot of insight into the FEMA process. And then because we have this perspective, or this kind of bird's eye view, if you will, of both the coronavirus relief fund process and the potential interaction with FEMA, we had been working with and coordinating with Cal OES to try to put together a little bit of a simpler cheat sheet for people to be able to assess how and where they might want to focus preparation of FEMA claims. And really you have to start with how you've documented items based on some of the guidance documents that have been put out and are available on the Cal OES website. And then once we've coordinated and kind of gotten review from kind of our partner sister agency, we're hoping to share more of that data and information with local entities to try to help demystify, as I say, some of this FEMA process. And I view this as very much an evolution. We are strategically at the state level trying to put forward different types of claims in some of those different areas to see how FEMA handles them. So what gets approved, what doesn't, and that will continue to inform and revise some of that picture that is going to take shape over the next coming weeks and months to help us figure out where it makes sense to pursue FEMA. And then, you know, because FEMA and even the coronavirus relief funds are not going to be the only source, I think as, you know, we all expect the American Rescue Plan will be signed pretty quickly by the president, that we would be able to maybe prioritize and use some of those funds in those areas that are a little more gray, or maybe even a little more burdensome. We've talked about, you know, approaching things based on the return on investment. So how much time is it going to take to do this documentation? And then how long is it going to take even for those funds to flow, which can be lengthy at times. So.
Okay, another question. Why aren't non-PPE COVID-related expenses, such as marketing of social distancing, mask wearing, and other preventative measures included in eligible expenses for FEMA? This is counterintuitive to what cities were asked to do to slow the spread.
I don't know that we would say that those are completely excluded at this point. So definitely an area that is something we're kind of monitoring and tracking. I didn't highlight them. I tried to keep this a little bit simple, and some of the areas that seem to be a little more clear to me. So I don't know that they're completely ruled out. It's certainly a discussion we continue to press at the federal level. And I think, you know, we probably have similar feelings as you do relative to kind of the need for that type of communication and outreach.
Okay, that's all for the FEMA related question. We have some questions related to the American Rescue Plan and some other things, but for now, that's what we have related to FEMA.
Okay, and hopefully we'll have time at the end to talk a little bit about the American Rescue Plan. Okay, so regarding the audit and oversight requirements, we've touched on these before. So the funds are subject to single audit requirements, and the OIG in their kind of outline of their audit process definitely has indicated that they will evaluate the prime recipient's single audit as part of their desk review. As a reminder, these funds are not grant funds, but they are subject to uniform guidance related to internal controls. And the OIG has also specified that they will be assessing compliance of the prime recipient's receipt, disbursement, and use of the coronavirus relief funds. As a prime recipient, the state will be responsible initially for any disallowances. And we've shared this risk through that certification process that cities had to follow before they could access the state funds or the state disperse those funds. Next slide. So as we have shared before, our broad intent around the coronavirus relief funds is really to make sure that the funds stay in California. That intent hasn't changed, and part of the monitoring efforts that we have set up is really to make sure that we're kind of working toward that end through our processes. So we believe that our oversight responsibilities and process really starts with guiding our subrecipients on the allowable uses of the funds to really create a framework that helps support local priorities that are consistent with the federal guidance, and giving locals discretion in terms of how and where to program those funds. We have really focused on making sure that the information we're producing helps to provide that information. We have our COVID-19 website. We've created user guides to provide some standardized definition and criteria around the different categories of expenditures. We've also published FAQs. And then in addition to all of that, we have fielded many hundreds probably of questions directly through our CRF reporting help desk mailbox to talk through different options or considerations relative to the use of the funds. And we have tried all throughout that process, including our desk reviews, particularly around using some of the categories that were not defined by Treasury, so kind of our category of other, to identify areas of concern. And our hope and intent is to make those assessments while there's still time to do something about that. Treasury guidance specifically says that if there is a federal audit exception found in their review and it's prior to December 31st, 2021, the recipient, the subrecipient, may shift those expenses to another eligible cost, again, during that covered period. So this is where we talk about kind of that backstop of public health and public safety expenditures, although there's probably a broad portfolio of costs and expenditures that would also be eligible for coronavirus relief funds. And as such, just want to remind and reiterate that public health and public safety presumption was done both to provide flexibility to local entities as well as to provide administrative convenience in terms of documentation. So a lot less documentation around the work or the activities of those public health and safety staff. The only documentation that's really required for those staff is the actual payroll and salary-driven benefits. That includes pension costs that can be used to spend down the coronavirus relief funds. Just as a reminder here, the CARES Act did not allow for the backfill of lost revenue, but this administrative convenience that we've talked about is a tool that can be used to kind of free up other general purpose funds that maybe don't have the same kinds of restrictions or even the timelines for coronavirus relief funds. Quick reminder here, records have to be retained for 5 years. And that is 5 years after the final payment is made. So if you're still liquidating some of the expenditures in 2021, so through this current reporting cycle, and that payment doesn't go out until now, you would need to retain your records until 2026. All of the documents need to really address the 3 primary questions relative in the CARES Act, which is 1, that it was necessary to respond to COVID, 2, that it's not in your recent budget. That does exclude, based on the federal guidance, the substantially dedicated staff, so your public health, public safety, that are presumed to be substantially dedicated, and any staff where you have directly tracked and monitored hours where they were redirected from their normal duties to a more COVID-specific task or duty. And then again, the covered period based on the state statutory framework, so March 1st, 2020 through December 30th, 2020. Next slide. So regarding the records retention, we noted this in our letter that went out recently, but it is going to be really critical to save those records now and share some of that high-level information with the state. So we want you to compile the data now while it is fresh, while you have the staff maybe in your office that are familiar with the reports, the backup to the reports, all of that stuff. Get that saved, put it in a folder or file drawer, whatever you need to do. I would label it, it's COVID and coronavirus relief funds, keep for 5 years. Do not, throw this information out. So just really important to do that. And we've started our monitoring in December of this year. We had hoped to be done with our first round, which was only 10 subrecipients. A couple things happened. We asked for a really granular level of detail and backup information for those 10 entities. We also encountered delays in being able to get that data sent to the state. So what that means is we asked for that data and information in December, and we have had to wait for it, which delayed our ability to review. And that really highlighted for me that we need to remind everybody, again, while it's still fresh, to make copies, keep those records together in a single location. And what we will be doing is we will be requesting that information for you, and we will have a file for every entity that has that basic data. Because the federal audit is going to start with the state as the prime recipient, it would be ideal, best case scenario, that the federal audit will look at our data, our record keeping, our tracking of the reporting process, all of the things that we have done to kind of guide you through this process. And they will say, we don't need to look any further. We've got, a pretty good picture of what's happening in California. However, as with any federal audit, it could involve a review deeper down and to the prime subrecipients, such as our cities and counties. Again, don't wait for us to ask you for the documentation. Assemble that file now. We think that if you're organized and we can demonstrate how together we have it in California, that we will fare much better with the auditors, and we will start off on really solid footing and keep all those dollars in California. Quick reminder here again about the importance of internal controls. I think somebody mentioned all of the different funding sources that could be used for this pandemic. So the record keeping and making sure that funds are only used or expenses are only claimed in one place through one of those federal or state funding sources. To the extent there is non-compliance identified, whether it's done through your own internal audits or a separate dedicated audit, or the state following up, take action quickly, correct the non-compliance, and take advantage of our ability to redeploy those dollars between now and December 31st, 2021. Let's see, I think I've covered it all, but again, FEMA, this disaster is unlike others. We have both the FEMA as a source of funds. We have have a public health pandemic that also has caused an economic downturn. And there are many fund sources that are available to try to both respond to the direct impacts and the indirect impacts and mitigate the overall effects of COVID. I already mentioned this. Oh, sorry, go ahead.
I would say we do have some questions related to the monitoring and reporting components. When you're ready.
Go ahead.
Okay. We have been told that certain negotiated compensation for safety employees, such as education and certification pay, are not allowable for CRF. Is that a benefit that is not a hazard pay or OT, which were disallowed? What is, and why would these be disallowed?
So generally what based on the FEMA guidance, I mean, not FEMA guidance, the CRF guidance, they talked about the salary and generally salary driven benefits. We think that, and this is advice, it is not a hard and fast rule, that some of those other special types of pay kind of fall outside of that. In one of our reviews, we have flagged a kind of an across the board cash out of sick leave. So if somebody was using sick leave, that would be eligible because it would be part of their normal compensation. But instead of them getting cashed out, which kind of boosts their overall compensation for leave balances, we have advised that that is a very gray area, and we viewed that very much like hazard pay. And hazard pay was specifically outlined as being in what's viewed as a very hazardous role or activity. It is not just generally coming into contact with the public. So we've kind of assumed, based on braiding together that guidance in the absence of clarity, that that's much more risky, and we would recommend drawing from a broader portfolio of expenditures and using the CRF there, not in something that might raise eyebrows at the federal level.
We have several questions about the requirement of not being in the recent budget related to the public safety element. So maybe we could provide some clarity there.
Sure. So the public safety staff, even if budgeted, because of that presumption of being substantially dedicated, can be paid with the coronavirus relief fund. So we talk about this a little bit in our FAQs. So go back to our COVID-19 website. There's FAQs that talk about that particular exclusion. It also is an exclusion if you've been able to document and track, such as time study system or time tracking system. And that could be as simple as an Excel system. It doesn't have to be an IT system, but to track where staff might be redirected. So I think I've shared with you before, our team had a very different function and purpose. We have been completely redirected to COVID-19. So we would basically be able to demonstrate, look, I used to do XYZ, now I do COVID all day, every day. And so we would be considered substantially dedicated. So while my position was a budgeted position, it's not being the way used and the way it was intended. Therefore, it is eligible to be paid out of the coronavirus relief funds.
Also, a couple of questions about whether or not entities should update their report and not include the previous amount for the 25% FEMA reimbursement.
So I will tell you what we are doing at the state level, and you can make a decision. We are taking a very much wait and see view. We think that given some of the barriers that happen kind of over a long period of time relative to FEMA fully approving claims that get submitted, that having some money set aside for the disallowances is probably a reasonable thing. So we are going to leave all of our coronavirus relief funds programmed as expended related to some things that we are in parallel pursuing FEMA reimbursement. As soon as we get clarity, and if we got FEMA reimbursement, we would reduce the amount that had been previously reported for coronavirus relief funds, free up and use those monies in another area, and thank FEMA for their federal funds in that particular area. So we're kind of taking a wait and see approach. When you close out and fully settle up, you can only have those expenditures in one place or the other, and you will have to demonstrate and document that, yes, we did some things in parallel, and once we got clarity and certainty, we made this change here. And you can see that change that shows the minus kind of coming out of the federal report for CRF, and that we accepted and drew down the full FEMA reimbursement.
A couple of questions regarding documentation for monitoring. Are there examples of documents that entities would need to produce to demonstrate necessity? And will having a copy of the jurisdiction's budget be enough to cover the second?
Okay. Do you mind, Audrey, going just quickly back to, I think it's one of the earlier slides that had a list of types of documentation. So while she's doing that, I would say generally, the necessary could be documented possibly through using meetings of your local elected about, based on these impacts of COVID, we want to invest money here. That could be one demonstration of necessary. Another demonstration is we have that descriptive field that's in our coronavirus relief fund portal. You could capture kind of why you determined, and we've seen some of those in that narrative section. It could be as simple as doing an internal memo to demonstrate we had this many businesses closed. We gave businesses this amount, and we took these steps to determine that yes, they were in fact closed, they had loss of income, that type of thing. So those are just some broad examples. Again, we want to give local flexibility to kind of assess what tells that story best. There was no specificity in the CARES Act beyond these three requirements. And then the federal guidance does not talk about a particular documentation standard, but has a laundry list of many things that could be used to kind of demonstrate how and where the funds were spent. So do we have any more questions on that? I think we'll talk a little bit more about
yeah, the only other question related to monitoring was somebody wanting additional information about backup or follow-up documentation for the economic support program.
Okay. And we've definitely have, I think we have it addressed in FAQs, and we've dealt with a number of questions around that. There is no specific standard, but we've certainly talked through that with folks, and we are available to do that as well. So as I mentioned before, we started our monitoring with 10 entities. We asked for all of the documentation down to copies of contracts and purchase orders and invoices. It became really apparent pretty quickly that that's a lot of information. And that's partly why we retooled kind of our broader approach to the monitoring process. We sent the letter out to kind of give people a heads up that we will be asking for information. We will be doing our subsequent and kind of ongoing monitoring in groups. We'll generally be starting with entities that have already reported their funds as fully spent. We are setting up a method or a process which was used previously for the data and the documentation to be submitted electronically. We are not being prescriptive, so the format is at local discretion. Whatever you think best demonstrates how you were tracking and reporting your expenditures. Certainly we can talk about advice when we do the initial engagement. So And then each entity will receive a unique link for them to be able to basically upload their data in a box.com account. We want it to be at aggregated summary level information. It could be a spreadsheet, it could be PDF documents, you know, based on system reports that you have. We do not want a lot of copies of contracts and purchase orders and invoices. We would do that kind of as follow on and more in kind of a random sampling approach. So we really want that high level documentation that we think would help make a really good, or paint a really good picture for California broadly when the federal auditors will come. And given the amount of funding that we received, we are rest assured they will come to California. So before we reach out to anybody, we asked in that letter for kind of a primary point of contact from each entity that we would kind of coordinate with or use if there are questions or follow-up information. We will meet virtually, so our audit team that's helping oversee this would meet and share with them kind of findings, rationale, and our recommendations. If the Treasury OIG asks for any of those types of reports or letters, because we do follow up with a letter that either says all is good, or we want you to relook at these things that are either clearly ineligible and or things that we think fall into an area that are riskier, and because we think most entities have a broad portfolio of expenditures to kind of choose from, there's probably better costs that could be adjusted. And then we would make those recommendations, and then we might follow up to determine if the recommendations have been followed based on subsequent reporting. And any additional questions?
No, that's all I have at the moment on that topic.
Okay. Well, we do have a couple of other just miscellaneous questions. I know JC's done a tremendous job answering those either verbally or with you, Kristin, or tapping those into the chat box. But just a reminder, if you do want to ask a verbal question, you can use the raise hand feature, and we'll be able to open up your line. In the meantime, I'll just start off with a question here that just came in earlier. How are the new federal funds being given to cities affect applying for FEMA funds? Will these federal funds allow cities to cover COVID costs?
So I'm assuming that you're mentioning the funds that are included in the American Rescue Plan. In general, California just, in the good news department is expecting at the local level $16 billion. Half of those funds would go out to cities and half would go to counties. Those funds are really fairly broadly flexible, at least based on the current statutory framework. However, CARES Act had 3 main requirements. We've seen a number of pieces of guidance over the last 6 months or so. So there may be some additional requirements, but at the moment, what we're tracking is they're generally flexible. They can be used to maintain services that would otherwise have been cut based on lower and lost revenues. So we know that a lot of local entities experienced kind of tourism taxes that dropped off precipitously, maybe taxes that are tied to restaurants that were used to support local programs. So the new relief funds could be used to kind of compensate for that precipitous drop off on lost revenues, and that would be compared to the prior year, the fiscal year basically revenues prior to the pandemic's onset. We see that the funds will go out in 2 different tranches, and at least 50% is supposed to go out within the first 60 days. Early drafts talked about potentially limiting the next allocation at the federal level. Basically, it had to be at least a year later. The most recent amendments kind of soften that, so it gives some discretion about whether they do a second tranche later on. There is a broad provision that the amount of funds that a city could get is no more than 75% of their total budget in the prior year. So there will be some method, I'm assuming it's through the application process, that Treasury would implement, would kind of ask for that proof or demonstration. And then the funds, most of our bigger cities, or what's termed as metropolitan cities, would get funding directly from the federal government. Smaller cities, so generally cities with populations 50,000 or less, would flow through the state. Unlike the CARES Act, there's no real discretion relative to that allocation, and the state is generally expected to pass those funds within 30 days of when we receive them. So first, Treasury gets 60 days to set up their process, set up the application, do their allocations within 60 days, then another 30 days for the state to allocate or pass through any of the funds that do come to the state level, which is really a workload saver from the federal government in terms of having to allocate to a bunch of smaller entities. The funds are broadly related to COVID, both the primary and secondary impacts of COVID. They can also be used, however, to invest in water, sewer, and broadband infrastructure. And then there's two main prohibitions. One, you cannot use the funds to for pension costs, so you can't use it to put or be deposited into a local pension fund. And I'm having a blank moment on the second provision. Lots of stuff in my head these days. And then the funds are available only through December 31st, 2024. So there is an end date in terms of reducing the funds. Oh, the other prohibition is you can't enact a tax or decrease either directly or indirectly between March 1st and the last day of the funds being received. So basically, they don't want you to take those federal funds to implement a tax increase directly or indirectly in the state.
Well, I think you answered the question and then gave us the quick rundown on the
I did.
American Rescue Plan. Nick, do you want to add anything to that? Nick, you're on mute, Nick.
Double mute. Okay. Thank you, Bismarck. Thank you, Kristin and team for all of this on the CARES Act. There's a question about, is the reporting requirements for the American Rescue Plan going to be the same as the CARES Act? Not exactly. We're still working out our relationship with your department, Kristin, about how to best communicate going forward. As Kristin mentioned, the state's going to be a pass-through for these funds. They're going to have a role to play in the initial part of making sure you all who are under 50,000 do receive your funds. And then the league, as well as National League of Cities, working through the federal treasury as we get guidance for our portion of the allocation. So if we have a chance to work with Kristin again, that'd be great. And team, it won't be, my understanding, it won't be as interconnected as with the CARES Act. And so we will be providing you over the next couple of days if we learn more about after the knock on wood signage on Friday, learn more about what the federal treasury is going to be required. We will requiring of cities to get the ball rolling and all the reporting, all the guidance that we need. We've received dozens of questions about eligible expenses beyond what is kind of on the face eligible. So we're going to continue to work just like we did with CARES Act to get you as much information as possible. So thank you all for your advocacy with us on that.
Yeah, and what we will say here at our level, as we've been doing with all of the federal funds, so not just the coronavirus relief funds, we are actively monitoring the federal guidance and various allocations, distributions. We will continue to share and pass that information along. And certainly if I were asked, I would be advocating, as is, I think, the league and national leagues of cities and probably other local and state governments, that the reporting not be on the detailed level. Certainly I would not advocate for 17 categories of reporting. It's been quite an onerous process, I think, for all involved. To the extent that there's something that's similar and we have to play a role because we are the prime recipient and passing through funds, if there are, in that application, any kinds of requirements that are imposed on the state, we would likely do similar certification, just like we did on the coronavirus relief funds. At the local level. And, again, we will reuse as much as we can to the extent that that makes sense, because familiarity is going to make things easier. And if we have a reporting responsibility and have to coordinate, at least with the smaller cities, we would continue to, approach it in a similar way as what we've done here.
Yeah, and just and Nick can supplement what I add on here. I know we're getting some quick questions on, what's in the recovery plan in terms of, I know Kristin did a good job of outlining it, but I'll just reiterate it. For cities specifically, and this is not the state or counties, we're looking at about 65 billion total federally for city, 65 billion total federally for all cities. And for California cities, we're looking approximately over 7 billion for cities. And depending on, and we've sent this information around through your city managers and fiscal officers, but depending on entitlement cities and non-entitlement cities, those amounts will vary. So your city should already have those estimates for you. As Kristin indicated earlier, it looks like the city disbursement will be put out into 2 tranches. And so we will, the first year you'll get your first half of it, and then the following year, within 12 months, you'll get the second. And then in terms of expenditures, I know we've talked about this a little bit, but these revenues we do consider fairly flexible, and it allows for use of revenue loss as due to COVID-19. And then it also added in the Senate changes, it allows us, in terms of use of funds, you're able to use it for infrastructure investments like water, sewer, and broadband infrastructure. And as noted, it cannot be used for pensions or directly or indirectly offsetting tax cuts. And then one thing that was added into the state and local relief plan by the Senate was a $10 billion critical infrastructure project program for broadband infrastructure. So we are awaiting more details on that. Where we expect that to get that information from Treasury over the next few weeks as to how that program will look like. And so that's generally what's in the American Rescue Plan, and we'll be actually looking to do a briefing with the National League of Cities either Tuesday or Wednesday of next week, in which we'll probably have more detail. The president is scheduled to sign the bill as of probably Friday is what we're hearing from reports from DC and other media sources, is that Friday the president will sign the bill. And so from there, a lot of action will occur with Treasury. And I know that our counterparts at National League of Cities and U.S. Conference of Mayors and others will be engaging on trying to maintain those funds to be as flexible as they can be for all of you. So we should have additional information for Tuesday or Wednesday, hopefully, when we make this announcement for a briefing next week. So stay tuned for that. But that's generally the top line on what we know so far. Nick, do you have anything to add?
I'll just update your 7 billion number to, I think, closer to 8. So I beat you by $1 billion this morning, but I think it's closer to 8. We have one thing that Cal Cities that we've been doing here has been to make sure that each and every city is accounted for in the congressional estimates that will be the basis for the Treasury estimates. So what we have done on your behalf is make sure that your city is in these allocations, that they're aware of your existence, they're aware of your population, the best available data on the population. You imagine the large spreadsheet of 19,000 local governments across the country. There have been some errors, lots of missing data. So on your behalf here, we've been able to make sure that the California data set is well-rounded. And so we'll continue to provide you information. I'm excited and I appreciate it. And again, let me say thank you to Kristin and team for your work on CARES Act. And we look forward to continuing working with you. And we'll send out stuff. I have a couple of things to send out. We'll send out the PowerPoint. We'll send out the recording. I think there's a FEMA memo that was requested. And we'll send you what we have on the American Rescue Plan as of today.
And I'm actually going to put, someone asked about where we can find resources regarding the HR bill. I just put in a hyperlink on the chat box. That's the National League of Cities page. And they do have a little one-stop shop that they just made live late last night. And we've been circulating around today that has the Senate changes outlined in the bill, has the allocation references. And then there's also the city by city estimates that the House Oversight and Reform Committee issued earlier in the week as it relates to all the new amendments that came in with the Senate. So if you can go to that, if you want to find some information, you got to go to the National League of Cities page and find it all in that one area, or you can contact your regional public affairs manager who has that information as well. All right, well, we have 1 minute to spare. I just want to say, Kristin, JC, Audrey, thank you for all your help. You guys have been tremendous working with us through this process over the last year. So thank you so much.
No problem.
All right. Thank you, everyone.
Happy to be here. Take care. Bye-bye.